Recently, I've seen a few women that have actually fallen, broken their wrists, and then diagnosed with fragility fractures. And that means they've had brittle bones associated with osteoporosis. I have another video that talks a little bit about what osteoporosis is with brittle bones, and that increases your fracture risk. I want to talk a little bit about now, what are some of the risk factors for osteoporosis? Well, there's some risk factors that we can control and some we can't. So some that we can't control are what we call non-modifiable risk factors. Well, that's some of your genes. You can't control your parents. Women, especially postmenopausal elderly women, are more high at risk. And then also, let's see, race, white women, and tend to be very thin body frame. So those are some non-modifiable risk factors. Well, what about risk factors maybe we can do something about? We know that women that smoke and that drink heavy alcohol, that significantly increases your risk of osteoporosis. Also, if you're sedentary, that really increases your risk of osteoporosis. If you are really sedentary, especially in your teens and your 20s, believe it or not, that has a huge cumulative effect many years down the road, and that will increase your risk of osteoporosis. If you have poor nutrition, if you have an eating disorder, let's say if you have some hormone imbalances, that will increase your risk of osteoporosis. And lastly, something we don't think a lot about, there's certain medications that increase your risk of osteoporosis. One is like prednisone, or if you take a lot of corticosteroids. And there's one of the most popular, famously prescribed medications on the planet called proton pump inhibitors. That's used for acid reflux. If you use those for a long time, there is some research shows that could increase your risk of osteoporosis as well. So when we think of treating osteoporosis, there's some risk factors we just can't change. So we try to focus on those that we can.